Gonna make it through this darkness. A light would shine someday for me. Yes, it will. I know that you won't leave me in this thing. Something doesn't feel right. Could somebody help me? I heard him say, hush, don't say a word. Gonna get messy if anybody heard. I heard him say, hush, don't say a thing. Think about the trouble you put me in. I heard him say, hush, don't you know who I am? A well-known woman, a respected man. Something doesn't feel right. Could somebody help me? Something doesn't feel right. Could somebody help me? I heard him say, hush, don't say a word. Gonna get messy if anybody heard. I heard him say, hush, don't say a thing. Think about the trouble you'll put me in. I heard him say, hush, don't you know who I am? A well-known woman, a respected man. I'm breaking the silence 'cause I'm under attack. No, I'm breaking the silence and take my life back. No, I'm breaking the silence and take my life back. And take my life back. And take my life back.
Very happy to chair this session on implications. We've had quite a bit of information coming our way over the yesterday and this morning. And I think we are looking forward to this session in terms of what are the implications in terms of the agencies responsible for policy. So I know you are looking forward and to hear what the panelists have to say this afternoon. Now, on my left and on my right, you would have, according to the program, we have panelists from representing the Children's Authority Board of Management, Mr. Joseph Raghunanan to my furthest right. He's a member of the Board of Management, followed by Ms. Monica Williams, the Director of Gender Affairs and Division, the Ministry of Planning and Economic and Social Restructuring and Gender Affairs of TNT. We also have our representative from the Ministry of Health, our own Dr. Anton Kumabach, the Chief Medical Officer to my left. We have Dr. Jasmine Ramcharan, Lecturer in Child Health, and she's also the coordinator of the Child Health Unit at UE and consultant pediatrician at the Children's Hospital at Mount Hope, right next to Dr. Kumabach. The furthest left, representative of our National Family Services Division, coming from the Ministry of the People and Social Development, TNT. To my right next to me here, we have Ms. Patricia Downer, and Ms. Downer is the coordinator of the Social Work Unit in the Ministry of National Security. So these are our panelists this afternoon. And I want us to move right into the session, just to say, though, that this whole issue of child sexual abuse has to also be placed in the context of the broader perspective of child protection. And I think why I'm also happy to be chairing this session, it's because I'm the chair of the National Task Force for Child Protection, which the Minister of People and Social Development appointed in October 2010, and we've really been working in the community and working with the key stakeholders to look at what the situation is and also to try to impact on policy and programming from the ministry level, from the government level. And also to say that we are looking at doing an assessment of the whole child protection system. We are working with our stakeholders to do that. UNICEF is involved with the task force, and we are looking to do this because we feel if we are to fix or if we are to strengthen the entire child protection system, we need to know what are the strengths, what are the weaknesses, where are the gaps, so that we could move forward in a more effective way. So with those words, I want to invite, firstly, Dr. Jasmine Ramcharan from the Children's Hospital, Mount Hope, to begin the presentations. Dr. Ramcharan?
First of all, I would like to congratulate the researchers of this project, Dr. Sandra Reed and Professor Raddock, for a wonderful job with this volume of research done. It must have been a mammoth task, and now it's up to the implementation. Why I am here is I saw in the initial research that they said there was a child abuse clinic at Mount Hope, which was started in 2008, right? So we actually started a clinic there in Mount Hope. And the aims of our clinic at that time were to understand the effects of child sexual abuse trauma on the child and their families, to reduce the vicarious trauma, and to try to develop tools to create healing in these children. But unfortunately, even though we had a couple of workshops to train people and to start the clinic off, it never really got off the ground. So what has happened in effect is that the clinic is run by one person, and we get referrals. You can just walk in with a referral from your doctor. That means you're walking into a clinic that is already being run by somebody. In our case, it's my clinic, the Child Development Clinic. So we have to additionally add these children to our clinic. And on any day, we don't know how many children will come. So we have our fixed clinic. We have children coming into the clinic who are just sent to us. Now, I don't like the designation child sexual abuse clinic. I have asked for that to be scrapped. And it's a stigma to have children come to say they've come to this clinic. We don't have that sort of clinic at all, right? So we have no specific clinic for children who are abused. And that is a real problem for the whole system, right? Because these children now have, it is not child-friendly, the clinic. It is a working clinic, and you are, if I am seeing one of these children who are sexually abused with their parent, one of my doctors may just knock on the door, come in to get my advice on another child, and things like that. So we have nowhere where these children could be comfortable, nowhere to see them in with confidentiality. And even when we do blood tests and whatever on them, they go with a batch with their names on it to be filed, and everybody's looking fit and calling the lab and saying this was done and that was done, and everybody's around and everybody can hear, right? But this is a working clinic. And in terms of confidentiality and child friendliness, it is not. There's nowhere to put these people to sit, to relax, to let them catch themselves. Nothing like that, right? And when we come to take histories, especially for the little ones, there is nothing to say we get them to do drawings, or we have anatomically perfect dolls that they could use. Nothing like that. We just have to run the clinic in the best way we can. So our main problem is probably the referral system. These children, when somebody makes a complaint, they go to the DMO, who then examines them, takes swabs, I assume takes a history, and then they send them to us. by the time they come to us, it may be 72 hours after, it may be a week after, depending on when the parents decide to come, right? And by that time, we have to take the history again, so this child is telling you the story again. And then I have to refer the children to the medical social worker, they tell the story again, right? And when we have no results back, right, because it goes to forensic, and we never get the results that the DMO did. So we have to do it again. So we then have to take more blood again. The little ones scream and cry, and when you have to examine them again, it's another problem. So this is not satisfactory, it's not child-friendly. We don't get the best out of them. The equipment we have is not that wonderful. We don't have the right equipment and everything. So in view of what the research showed, Dr. Reed, etc., their research showed, we have problems, we have certain problems. We have no standard reporting, which is a big thing. We need to have standard reporting. We need to have a definite and universal protocol, which is not present. Because as it is, we have varying protocols and procedures. One child may get, if you're over a certain age, your doctor may give you antiretrovirals and contraception. Others may not get it, right? Others may get a pregnancy test, some may not, that sort of thing. The young ones, the very young ones, we have a definite problem with treating them the right way. We have, especially how to interview, how to conduct an interview. And as it is, there's lack of sensitivity, I think, in what we have to do. In repeating the history, repeating the examination, repeating all these things on the same child. And in some cases, if we don't get the results back, parents come to the clinic, the results are not back, they have to come back, and we have a lot of dropouts. A lot of people drop out. There's no formal systems for them. They may see me, or they may see on their second or third visit, they may see a junior to me, and there's a mix of staff, a mix of experience, and things like that. I normally do all the examinations myself. And to tell you the truth, a lot of the staff is very emotional for them. So according to the research as well, you need to have self-care. There's a lot of burnout. People stop seeing some of these children because they can't cope with it. And so what we need, we have organization, but we have a lack of structure. And it's suboptimal. We may have duplication of services because we may send the children to child guidance clinic where the social work services are duplicated. Some of them, Dr. Sharp and I have come to an understanding and an agreement that if I think the child guidance needs to see these children, they will see them. If not, we will do it with our staff that we have. And the staff basically is one social worker, right? And when she's not there, when she's gone on the field or she's not around, you have to get an appointment. Many people don't keep the appointments. So we don't have a proper follow-up. We don't know what is happening to these children time and time again. They're lost to follow-up. If we see, if we get a positive result, we have to trace these people. We've had an experience where they gave wrong phone numbers deliberately, and we couldn't find this child. And this is a real problem because the programs are not standardized. We don't have any follow-up programs as such, except our social worker on a Saturday, she, out of her own money and her own time, she has encounter groups. So we don't have anything too much. So the outcome for us is there are problems with resources, with personnel, economic resources, trauma to the child and family, duplication of resources. This leads us, we are seeing a lot of things like unhealthy sexual behaviors, teen pregnancies, and it all is a vicious cycle. We would like to have more collaboration with people like the police. For example, if you have a child who's been abused and you go to the police, you have to have a female police officer. So you may go from station to station till you find someone who will come. And we need to have specific protocols that the doctor who's seeing the child will do the same thing, so we don't have overlap and we don't have to redo everything again because we don't get the results back. We need to be able to change the name of the clinic. We need to have what we envisage was a family clinic, right? Where we would see these children with, who had been abused, some of the children who were HIV positive. There would be no stigma, it would not be called anything but a family clinic. But we could not do that because of lack of funding, lack of staff, things like that. And we need to collaborate more with the social services. We need more help and the NGOs. As it is, what lessons we have learned is that the children remain victims. They have no rights so far. And service delivery is practically non-existent for us. There's an increasing demand for limited services. The services are extremely limited, and we need to strengthen our support. And most of all, education is needed to help to empower everybody. I mean, we could do with training for the staff, we could do training for the doctors, the nurses, the social workers, everything. And for the parents, as we stand here, we really don't have much to fall back on. It's not all doom and gloom, because some of the parents appreciate some of the sessions we offer, and we do see some positive results. Thank you.
We are going to ask Mr. Raghunanan, who is a representative of the Children's Authority Board of Management.
Thank you. First of all, let me say that I might not be able to respond to the format expected of me, primarily because it was only on Wednesday I knew I was going to be here, and I wasn't here to listen to the presentation, so I will not be able to respond, in terms of the format that is expected of me. The Children's Authority is based on the Children's Authority Act. We had the Parent Act 64 of 2000, and that was subsequently amended in 2008. Well, you know what happened in 2000? The then Attorney General, Ramesh Lawrence Maharaj, laid in Parliament a children's package of legislation which consisted of 5 pieces. And only one of those 5 pieces became effective law. And then there was change in government, and there have been review of the package, now expanded to 7. Then we have change in government again. So at this point in time, of the 7 pieces of legislation, 1 is fully proclaimed. That is the Civil Child Abduction Authority. That's fully proclaimed. The Children's Authority Act has been partially proclaimed. And if you're interested, you can look at legal notice number 187 of 2008. And you would see which sections have been proclaimed, giving putting a board in place and giving the board the authority the responsibility to establish the authority. So there's a board in place, and the board has the responsibility to establish the authority. The authority is not yet functional, and the main reason for, fully functional, and the main reason for that staffing in the main. So the board has been engaged in setting up preliminary systems leading to the full operational procedures of the board. We have developed compensation packages, etc., did job descriptions, did a whole organizational structure, and we advertised recently for key personnel, and those interviews are going to start, tomorrow morning, for filling key positions, which will lead to the authority, becoming fully operational. The authority is charged under the Children's Authority Act to look after all matters of care and protection of children. And the Act defines who is a child in need of care and protection. Once a child is deemed to be in need of care and protection, the authority has the responsibility to establish assessment centers where a child who is in need of care and protection will be brought into the assessment center. There will be qualified personnel, including child psychologists, psychiatrists on call, pediatricians, social workers, etc., to do a complete assessment of the child. And the Act lists several areas which must be looked at in the assessment of the child. The authority also has the responsibility to place the child in a place of safety. This place of safety can be a home established by the state or it can be one of the private homes which will have to come up to certain standards. And the child will then be placed before the family court or a court dealing with family matters. That's how the legislation is drafted, because we know the family court at this stage is just a pilot, in this pilot phase. And the child will then be under the care and protection of the authority. There are several, now one of the differences between the previous legislation of 2000 and the one we are now working with is that the child will be required to be presented before the courts, so that the courts will make a determination whether or not there is cause for removing the child from the control of the parent and putting the child under the control of the authority. Previously, it said the minister could just move the child, and it was deemed that if that happened, then the authority could be in court every Monday morning, because parents would be taking the authority to court, you know, questioning and querying, contesting, why did you remove my child? So once the child comes to the attention of the authority, there is a time frame for the child to be placed before the courts. There would be a hearing and there would be a court order putting the child under the care and protection of the authority. And then several interventions will take place. The legislation is so structured that any child, well, every child resident in Trinidad and Tobago will fall under the control of the authority. So once you are residing in the country, you are under the protection and care of the authority. You know, that's as much as probably like I want to say at this point in time, and then I'll respond to questions as case may be. There are a couple of things I just wanted to also to respond on the basis of some things that came up yesterday, and it has been coming up in different quarters. The question of a sexual abuse register. And the Children's Authority will have, by legislation, the authority to keep a register. But I would also want to draw people's attention to Act 31 of 2000, the amendment to the Sexual Offences Act. And this act calls for the judicial officers to, I'm trying to get the exact words here, but it allows the judicial officers to give an order, a notification order. It's a notification requirement. And all individuals who are convicted of sexual offenses are required to report to the police station where they reside. And the police is required under the Sexual Offences Act to keep a register, so that those who are advocating for a register, until the Children's Authority becomes fully operational, I would recommend you look at the provisions in Act 31 of 2000, and the Minister of National Security, or the Ministry of National Security, should be asked to look into the implementation of that particular requirement, which we already have in law. So we don't have to go looking for legislation when one exists already since 2000. Then the question of marriage, you know, the issue of marriage came up also yesterday. And in terms of the Children's Authority looking after all children in the country and so on, the like I said, there are 4 marriage acts in the country, and whereas there are those who are looking at the Muslim Marriage Act and the Hindu Marriage Act, I also want to draw attention to the Civil Marriage Act, where it allows for a minor to be married with the consent of an adult. And there's a description of the adult. So it's not just the Hindu Marriage Act or the Muslim Marriage Act that allows for a minor to be married. The Civil Marriage Act allows for that. The Muslim Marriage Act says that the male can be 16 and the female 12. The Hindu Marriage Act speaks about the male being 18 and the female being 14. And as I said yesterday, the Orisha Marriage Act speaks of 18 for the male and 16 for the female. So those are the provisions we have at this point in time. So if we are advocating for the rationalization of the Marriage Act, we just cannot focus on the Hindu and Muslim Marriage Act, because their religion, and we have to bear this in mind, their religion has certain supporting roles to play. So once an adult gives consent, then there are provisions within the religion for certain adult supervision. So I just thought I'd respond to those 2 issues that came up yesterday, the one of the marriage and the one of the registry.
Our session here and the implications for policy, we're going to ask Ms. Monica Williams, who is the Director of Gender Affairs, that division in the Ministry of Planning, to make a contribution at this point. Ms. Williams.
Thank you very much, Mrs. Bailey-Sobers. I want to join with my colleagues in complimenting the Center and all its partners for this forum. And I was at the stakeholders roundtable and knew that more dialogue was needed, and I'm happy that the plan of the organizations, it is rolling out well. And I'm starting at the end to say that I really am hoping that, as I was expressing during lunch, that we do not end up with to be just another dialogue session, but that there is action, continuous action. I know the partners and ICDGS, they are into action, and I really would like to see the action continue, because I think I have taken a position, probably out of my job, even though I'm speaking here in that capacity, that I would hardly attend forum like these, because after a while you feel that you're just repeating yourself and everybody feels that you're just talking. And so I think as a country we need to start really becoming stronger advocates for things that, you know, we think are important. And I really want to compliment ICDGS and its partners for moving this along, because I think over the last couple of weeks, I am hearing a lot more now in the media in terms of the positive work that is happening in terms of breaking the silence, because many times it's only when something happens, and the negative is when you hear all the things that are required to be put in place. Unfortunately, I was not at yesterday's session, and by the time I found the group this morning, Professor Ruddock was finished, so I didn't hear her presentation as well, and today we asked to comment on those sessions. However, from the knowledge that I have of the exercise and from the documents that I received, I would want to position the ministry. I'm speaking on behalf of the Gender Affairs Division, but we are positioned in the Ministry of Planning, Economic and Social Restructuring, and Gender Affairs, a long set of words. But I think there is some meaning in there, because the Ministry of Planning is supposed to be central to national planning. And clearly from what we have been hearing and as from the results of the study and from contributions I heard on the floor, what was coming out, what I was hearing is that there is sometimes an absence of a cohesive plan as to how we treat certain issues. And the Ministry of Planning, from where we sit, is supposed to really be that gel, that thing that brings together national planning. And so even when we have protocols to be established, that they are just not paper protocols, but they are action protocols. Because throughout the discussion and dialogue this morning, what I picked up from the floor is that some agencies were saying, well, I don't know what another agency is doing. And sometimes if you know, there's a lot of goodwill on the part of a lot of social workers and counselors and professionals in this country. There's a lot of goodwill in what people do. But if you look for that document which says that this is the course of action to follow, and if you have a case reported here in the police station, this is what, there is sometimes that because the legislation would say what you're required to do or some kind of manual or something. But how many times do we really follow it, and how do we enforce it? Clearly from what I was hearing, and not from what I was hearing, from what I know, it is a problem. Recently, I had to interface with a parent whose daughter was a victim of rape, and I was asking questions based on my knowledge of how this issue is to be treated. And she was saying, well, no, this was not done, no, that was not done, and rather what was done was the daughter was criticized for going out late and taking a drop with some guys, and these are all teenagers who she knew, and she was gang raped. And so rather than provide the kind of support and the collaboration that was needed, this child was re-victimized. And one has to look at that in terms of how we look at the women and we look at men, our roles in society as young people. Because one of the things she was told, and the study picked it up somewhat, is that as a young woman, she should not have been out of her mother's house at that hour. And so we tend to judge where should the boys be and where should the girls be. And it was as though we were condemning, and I say we as a society, we were condemning the female for her action, but yet the young men who did the raping were not seen in the same light. And one has to be really careful. And as service providers, we really have to be careful of how we interact at those levels. What came out, and I'm going to try to be very quick, was again, the reinforcement of the need for the HFLE program to be revisited, to be implemented. Nearly every forum you go, you hear the same thing. And it really is about time that we start to treat with it. I know some people have difficulty even with hearing the words HFLE. And so sometimes it's implemented, sometimes it's done in a piecemeal way, it's done all. I know as a fact in terms of teacher training it is done, but what is implemented, what is executed, I can't say because I don't have the knowledge, so I'm sure there are teachers in the room who would be able to see. But we can look at that, and it could be age appropriate, so that as young as possible, the children start getting exposure to the information. I have known, and I'm sure I saw medical social workers in this room who know, and even some of the social workers who know that they are victims. I don't like to call them victims, but people, young children, females, who were exposed to child sexual abuse as young as 2 years, 3 years, months, and I know one that's 4 years. So those are some of the things that, we need to treat with. How do we educate the young children from a very early age about what is appropriate and what is not appropriate, to help better prepare them, because many people live for years accepting the abuse until they know better, until they could speak up because of the fear or threat of death or all these issues. Again, coming from the floor this morning, I made some quick notes on the issue of re-victimization at public and other institutions and homes. To me, I heard that coming through, And what came to mind immediately was the issue of boys not being accepted at some shelters if they go to a shelter with a female who has been abused. Sometimes when the children speak up in the home, it creates problems, and the mother is oftentimes abused by the partner because sometimes it is felt, well, I am taking care of you, I'm taking care of this household, you can't speak up about it. Who are you to threaten me? And so the woman goes into a situation of fear where she has to run for her safety, she has to be removed, she goes to the shelter says, I can't take you, your entire family, if your boy is over 9 years. And so therefore what do? We separate and split up a family, and it's further traumatic for the children. Sometimes even that child was also a victim of abuse. So even in terms of the protocols and in terms of the guidelines and all of that, is really, really complicated. But I think I am really hoping that through this dialogue, something further can happen. In terms of service providers, I know at the stakeholders consultation it came up, and I didn't hear Dr. Reddock's presentation, but I'm sure she spoke to it, the issue of gender sensitization, training, and general gender training and awareness training for service providers at all levels, including the police service of Trinidad and Tobago. I know my colleague from National Security may speak to it. I recall some years ago the Trinidad and Tobago Police, in collaboration with the Canadian, it was CEDA, I think it was, had a training program, a very thorough training program it was not only for police officers, but it was for social workers across the board. I think they took some of us into that training to help prepare individuals to interview children who are victims of sexual violence, both boys and girls under the age of 5. I have seen policemen use it and use it effectively. They had the dolls, but even a simple thing like getting down to the level of the child is small, so you stoop to do that interview so the child doesn't feel intimidated. I've seen it work. But with things changing all the time, I'm not sure how many of these police officers who were trained are still around, how many social workers who were trained are still around, you know, so continuous training is required. And so how do we, even in terms of planning ministry, ensure that those things are factored into the plans of each ministry? The need to address deeply entrenched cultural norms and beliefs which reinforce negative gender stereotypes. And so many times this morning the word stereotype keep jumping up in my mind. We are really strong on stereotypes in this country, regardless of the time, whether it's gender, cultural, whatever. And so therefore, how do we really examine our beliefs, especially those deeply entrenched ones that allow us to continue with certain things? It's sometimes in some sectors of the society, it may be taboo to even speak about the sexual violence when it happens, because it is making our family or whatever be seen in a particular light. And so therefore, while you may hear that in some areas it's free and they could talk about it openly, some people keep it closed. And so therefore, how do we really get people to understand that it's beyond just, it is more than just an act, but you are hurting someone for life, and that there is, if you don't treat with the problem, you could be affecting somebody for the entire life. I know at the round table we spoke a bit about, at the table I was at, spoke about some of the situations where we have resulted in prostitution, both by young men and young women. Some of those who have ended up in prostitution, that was part of their problem when you interview them, being victims of sexual violence from even an early age, and the things that were said to them, and as though it was acceptable for different reasons. So how do we really, and so I don't have the answer for that, but I am saying, how do we really start to explore some of these things in some more detail? The issue of ethnicity is tied into that, and how the media campaign can address some of those very issues. When we are targeting, do we target just for young boys, for young girls, for men, and for women in a general way, as though we are all one grand homogeneous group? Or do we look at specific messages and the language that people would understand based on not only on age but on ethnicity if necessary. And I'm seeing it happening even in the commercial targeting in Trinidad. For some of you who probably look at advertisements with that lens, that I probably just look at everything strange sometimes. But in terms of I don't like to call companies' names, but I will this time, in terms of the B-Mobile ads and some of them, you see them varying the ads to suit different markets, and it also suits the different ethnic markets as well. Let's be realistic about it. And so therefore we probably need to look at some of that as well, because they are reaching people. I think I spoke about the issue of the issue of breaking the stereotypes, and I know I heard Dr. Mora this morning, and when I heard, I was saying transformation of the society is so critical, but how do we get it done? And so many speakers spoke about the issue of men and how they can be helped. Some passionate views from the floor, and I keep saying in my mind behavior change, but how can we change individuals? I am not the expert in that, so I would imagine some of the people who are the experts in that area may speak to some more about it, because it's an area that we have been struggling with in the Gender Affairs Division. In the past, a lot of the programs and a lot of everything focused on the women, and we continue to do that, because when the statistics, as has been shown up in the statistics here, you have a greater percentage of young women being affected, but there are still young men who are affected by the situations we speak of. So how do we, we help them? And not only in terms of those who are affected in that way, but the perpetrators of the violence themselves. How do we get people to really accept that I have a problem and I need to get help, I need to do something differently? The last point I would want to speak to, until the question period comes, is the whole issue of economic activity. Again, a reality check. I'm almost sure, I wasn't here again, that I don't know if Professor Reddock spoke to it, the fact that some children, both girls and boys, are victims of child sexual abuse, but that it is part of what, I don't want to call it the family wants, but they are used as pawns in an economic game. And it's a reality in Trinidad and something we really need to look at, because we don't look at the whole issue of poverty and situations of poverty. I don't know if you want to call it poverty, because some people, poor people, won't do that. But the whole issue of economic activity, economic dependence, interdependence, and how that spills out to all kinds of issues, including HIV/AIDS. And the reality is we really have to really examine the whole situation and see how best we could address it. So it probably means, in some situations, treating with the parents in terms of their economic activity, finding ways to help them, so that they then in turn see how they are impacting on the lives of their children. Because they would tell you, sometimes some of you children will say, when I told my mother, she said, well, he minded me, I can't say nothing. And some parents are actually sending out the children, both boys and girls, to engage in sexual activity to bring back the funds to take care of the family. So let's not hide our heads and believe these things are not existing. My ministry is charged with economic and social restructuring. I am supposed to be sitting on a committee which will be looking at the social restructuring part of the society, but that work has not started, and I really do hope that we talk, in my case, that we really talk less and get to some more action. Thank you.
Our representative from the Ministry of the People and Social Development, and she is Ms. Vidya Ramgati, and Ms. Ramgati is a senior officer, a coordinator in the National Family Services Division of the Ministry, and she will speak to the implications with respect to that division and also some of the other divisions of the ministry. Ms. Ramgati.
Good evening, ladies and gentlemen. I want to congratulate the research team, and I'm excited about the whole issue of the child sexual abuse awareness and the whole conference. Now, I will approach this, my presentation in building and enhancing capacities, right? So at the opening ceremony, the Minister, Douglas, and even Mr. Raghunanan from the Children's Authority spoke about the Children's Bill, and this is a package of legislation which will deal with all children issues. So it's building and enhancing capacities for child sexual abuse. Now, the National Family Services was established in 1991 to enhance the social functioning of all families. At National Family Services, we have trained social workers who will deal with all family matters, and child sexual abuse is one of them. Now, we have protocol, child abuse protocol, where we use our theories, the crisis intervention and empowerment theory, the system theory, to do our psychosocial intervention. Now, that is our reactive work. We also do proactive work, which would include workshops, lectures, community meetings. This is the educational aspect where we deal with all social issues. And here I want to take the liberty to say that we would like to have a collaboration with the Break the Silence team, because that is some of the work that we do. Now, at National Family Services, we have the foster care unit, which is a provider of placement in a home for child sexual abuse, right? And we have foster carers who will deal with caring of these children in a home setting, right? We also have our challenges for that unit, which is staffing and having enough foster care providers. So there we have the building and enhancing of capacities, right? And recently, the beginning of this year, we have the parenting unit, which is established. Now, the parenting unit will take over all the workshops and have community meetings and parenting support groups, and we will have, this morning we had a parenting agent, so we would like to establish all the parenting agents out there, and to bring out awareness and deal with the family issues in a grander base. Now, in the Ministry of the People and Social Development, which is where National Families Day, we also have other units like the National Plan of Action. This is a policy unit. We have the AIDS and HIV unit. We have Policy Program Planning and Development, NADAP, who will deal with all substance abuse. We have the Social Welfare Division and the CCTP, which is the food card, commonly known as the food card, which will deal with all financial aspects. We saw in the script the final dependency on the perpetrator, and we have these units who will help with some of the issues that the family will be having. We have the monitor and evaluation unit, and we have community mediation department which help in resolving disputes. And they also have 5 parenting support groups in the community. And then with the establishment of the people issue unit, so we deal with all people issues that will go directly towards a holistic approach, right? And the team effort towards child abuse. So we are having to have a more child-centered service, which will be more culturally appropriate to the different practices that are out there in the different areas. We have officers in all the different counties, so when we do our statistics report, we will get trends from all the areas of Trinidad. So the workshop will be in dealing with the specific areas problems. And that is building and strengthening capacity. Now, we also have our staff constraints in National Family Services, where we had approval from the cabinet for social workers, but to find them is another thing. Then to train them to do the wide spectrum of work that we do is another challenge that we meet. Another collaboration that we have with the Children's Authority, what Mr. Raghunandan spoke about, which will be responsible for all children issues, building and enhancing capacities, right? And they will also deal with the setting standards for the operation of the children's home and all issues dealing with children, building and enhancing capacities. And we also have in the educational system, the school social workers, we have the guidance officer. We also have the child line, the hotline, which is now 24 hours, and the student, it is a free hotline where students can speak to any problem that they have. We have the police service and we have a representative, but most of all, we have the victim support unit in the police service to help victims of child sexual abuse or any crime that they have submitted. And there's also the re-emphasis of the community policing, which is very important, and we collaborate with them. And we will also, I am also making a plug for the UE research team with the action-oriented research intervention and breaking the silence to raise the awareness of child sexual abuse. Right? And I have some recommendation which I think will help with the policy, the mandatory testing of HIV/AIDS for all child sexual abuse person, a user-friendly social services with no stereotyping and stigmatization, the removal of the perpetrator from the home instead of the child as a policy, the child-centered services using the public health model where we deal with it in a holistic way, and workshops, storytelling, community for caravan workshops, and an emphasis on gender role ideology, awareness of male-female sexuality. And again, I want to make the plug for the collaboration with the Break the Silence project. I thank you.
Thank you so much, Ms. Ramgati, for your contribution, and to let you know that quite a bit is going on, but most people not aware of what's taking place in some of the agencies, and that's why we're sharing this afternoon and giving some of the implications for policy for these findings. And at this time, Ms. Downer from the Ministry of National Security, the coordinator of the social work unit, she will make her contribution. Ms. Downer.
I am the social work supervisor for the northern region of the Trinidad and Tobago Police Service, EAP service. Okay. I would like to approach my task today by, first of all, looking at this. I must say that I am not talking directly from a policing perspective, but rather as a social worker associated with employee assistance in the police service. And in terms of giving that kind of support in the police service, there's a social work division which comprises of social workers in the North office, and we are situated at Sierra Vista Drive in Arima, but there's also a Southern division. You're not hearing me? You hear me now? Okay. There's also a Southern division currently associated at the admin building in police administrative building in Port of Spain. There's also a victim support arm that is scattered throughout the country as well, and victim support, as the word suggests, works with victims of crime. Okay, so that is the kind of support that's given in the police service. Now, with respect to national security itself, there's also a HIV coordinator, and the HIV coordinator is directly responsible for building the capacity of the Ministry of National Security to mainstream HIV and AIDS throughout all Ministry of National Security department, that include fire and prison as well. Well, I raised some already some of the concerns I had with respect to findings, and so I would like to at this time make mention to some of the things that I've already raised. And one of the findings had to look at community response to abuse, and some of the negative ways, or I should say ineffective ways in which, or inappropriate ways in which community respond when children are abused. And I think someone in the audience talked about the importance of community involvement in preventing sexual abuse and in supporting and managing children. And as I want to speak to that in terms of where we are with respect to community. You know, it's not the same as where we were with respect to community a few years ago. Community plays a vital part in our lives, and there was a time when our geographical community matched our functional community. But that time is not now. You know, we have a lot of communities of people who are not homogeneous being thrown together in a number of housing schemes. And these schemes are not worked in collaboration with any social services. So you have a number of people with different systems of values coming together and living side by side. And yes, I agree that our neighbor, the concept of neighborhood is very important, because our neighbor plays a very vital role with respect to our safety. Because if we didn't have neighbors on a street, we wouldn't live on that street. Our neighbors lend, or I should say, supposed to lend a level of safety and also provide an emotional outlet in times of distress. And it often is a first response in times of crisis. But even the concept of neighborhood needs to be re-examined, because people now put up walls. And sometimes the walls are to protect you from your neighbor. I have worked extensively in mental health, and often the abuser might be a trusted next-door neighbor. So while we want to revisit the concept of community, it has to be very guarded in terms of how we use community, bearing in mind that we have communities of violence and we have communities of abuse, and we have communities that benefit from abuse, you know, and then we have communities of people who might have a level of apathy because of constant abuse and constant violence. So all these things have to be taken into consideration with respect to policy on community. I know that the Ministry of the Trinidad and Tobago Police, as a matter of fact, has a drive to take policing out into the community, and there's a project that is on. I think I have one of my social workers who could remind me of 21st century project. Policing, and the 21st century policing is currently being piloted in the Western Division, and the whole idea is to take policing out of the police station and into the community, so the police are on the street 24 hours a day, you know, where I think they got 4 days off and 2 days on, and a number of police stations, I think Patna Village is one, I think Karanach Police, and a few of the police stations are no longer police stations but are now processing centers, so that the police respond to a call for help rather than the other way around, where people used to go to the police station to get support for help. So that is in the pilot stage, and I think at the end of the evaluation process, it will be replicated in other areas. So, and I do stress, I think the importance of community in crime detection and crime management cannot be overstated, you know, and therefore it is important that the community has a strong relationship with the police in order for mutual sharing of information, which is quite necessary because the community has information which the police can use in crime detection, and the police also have information that the community can use in crime detection, but because of the fact that the relationship between community in the past has been one that is so fragmented, and I am speaking with respect to an evidence research that was done by the Citizen Security Program a few years ago that shows a negative image of the police, a negative perception of the police by the community. And because of that, I think that is the driving force behind many of the initiatives that takes policing out into the community. Collaborating with the various agencies, that's also a very important aspect of the work that we do, because in times of crisis, per se, the police need to have an effective system of collaboration with health, with family services, with a number of other social service agencies in the area to have an effective response. So collaboration is also in that person sometimes sees the man who's supposed to be working going back home, you know, when the children come from school, and a relationship there plays a vital role, but also that has to be taken into the context of the fact that we live in a very violent society, and therefore people are reluctant to talk. So you need a relationship of trust with the policing service in order to make that effective. Also, what was raised is the whole issue of training of police officers. Yeah, and I do say yes, there's a need for training and ongoing training, because as my colleague here spoke about the fact that police officers were in fact trained at Cascadia in interviewing children below the age of 5, but with the turnover and people leaving and so on, you find that you know, that resource has dwindled. However, again, collaboration and training plays a very important role, because I recall a situation where a young girl was kidnapped and taken to a health institution. And the police depended on the medical for, as part of their evidence. And the medical was almost blank because the officer interviewed the girl, who was obviously stunned, having gone through a trauma ordeal of about 3 or 4 days. And when she was asked, everything all right? Yes. Did they do anything to you? No. But later, when I saw her, it was a different story. You know, so that kind of situation, there need to be some kind of collaboration and some kind of protocol being established at our institution. I know that there is a policy with respect to PEP, post-exposure prophylactic, put out by the HIV unit of the Ministry of Health. I am not too sure as to what extent that is followed, because I know of situations where people have been to accident and emergency with children under 14 having been raped, and that has not been followed. One woman called me and she said to me, the doctor refused to give her child any antiretrovirals because he said he don't know what is a pediatric dose and he's not getting into that, you know. And so these are the kinds of things. So while we may have policies, you know, enforcing these policies because of the fact that there is no legislative response, it is difficult to enforce these policies, and it is difficult to have the kind of policy response that make the use of these policies effective. So I don't want to, how much time do I have? So I'll try to wrap up as quickly. We also have the whole issue of safe homes, which I want to talk about briefly. You know, we all know the difficulties with that. And we also, the whole issue of data collection. There's a lot of reputation with respect to data, and I think that needs to be sorted out as well. And what is our role as social workers working with the police? Our interviewing children who are sexually abused are often very traumatic for police officers. Dealing with children who have experienced violence are often very difficult. Our role is to support the police officers, and we do that by conducting a number of debriefing sessions with police officers, and we also do follow-up trauma responses. And also, I think the social workers could continue to help with respect to that. And with respect to interviewing children, I think the victim support officers can play a crucial role in collaborating with the police officers in that process. So I think that my time is spent, and thank you very much for your patience.
We have the Ministry of Health represented by Dr. Cumberbatch, and I just want to turn right over to him to make his contribution. Dr. Cumberbatch.
Well, first of all, let me thank the organizers for inviting us to, as the Ministry of Health, to share this panel. Also, let me apologize for not being able to be present for the entire presentation. But because of that, I'm unaware of what was presented, so I'm just trying to read and get a sense of it. But having said that, I want to immediately put some positives on the table. One of them is that at the Ministry of Health, we have a unit that is called EVIPNet. And EVIPNet is really changing evidence to policy. So there are two parts of it that is really important to this discussion that is going on. At the moment, we are refining a policy brief with respect to injury and violence with a focus on sexual abuse to lead towards policy changes in the ministry and all the organs of the ministry. So if you have done research, which you appear to have done, we would like to share in that information, because the research has to go to evidence. And the evidence, we can use the evidence to make policy changes. So it will be important for this bit of research to get to us as an urgent matter. As I said, the policy brief is being developed. I actually chair an intersectoral committee on injury and violence prevention using a public health approach, and we have to report to Cabinet in relation to a strategic plan for injury and violence. So this does not preclude you from catching that train. So, as I said, we would like to get that information, even a presentation and a discussion. That's one. So we look forward to the continued research in the area. The second thing, I would just like to support Dr. Ramcharan. I heard her cries, operating as a solo operator in the Moncton Hospital. And I just want to say, we'll have a conversation afterward, but let me just make publicly that we can assist from at the policy level in the ministry to assist you within your unit, even though you're operating in a decentralized environment. and we will do that. And the things that you're mentioning are not really beyond us in terms of resources. To the speaker who just spoke before me, we do have a protocol with respect to HIV prevention and what to do in terms of not only for children, but for rape victims or sexual abuse victims. And if in fact, and there are protocols and standards of operations for the medical officers, and if in fact our medical officers are not following that, the medical officers are supervisors, they're the county medical officers of health, and if you don't respond to you have my office so that we can intervene. So if they need further training on what to do or what not to do or how to handle it, we will provide the support. We have put that in place and we continue to review it at all times. For those who are sexually abused and come through what we call the medical legal process, where people are brought in by the police. And let me also say, because you know I've been listening and I've been hearing a lot of statements where people seem to be feeling that things are not happening. But I have been in the health business for many, many years, and we are far advanced in modernizing our systems than what we were before, I can assure you of that. And I would like to really compliment the police, because I would say over the recent set of years, we have had a major change in how the police deal with children and sexual abuse. Very, very positive, and we want to continue working along that line together with you all. And I said, if our officers are falling short, please let us know so that we would ensure the correct training is dealt with. I want to get to a point here, and I'll get back to the health system. I saw that the nature of the presentation was understanding and preventing child sexual abuse and HIV risk. Well, I think the problem is larger than that, is understanding and preventing child abuse. What I would like to know, I was not here at the presenting of a model, because from a public health point of view, and that is what we do in the ministry, we do clinical things, but as the chief medical officer, we do public health approaches. And the public health approach says, if you have a problem, you need to understand what it is to prevent it. A lot of what we have been talking about here is really intervening after the person has been abused. So we would like to have the understanding of what are the risks involved in the communities and those who are at risk, to intervene at that point so that we don't have the abuse. Now, the health system has a unique opportunity, and the opportunity is that we see everyone from cradle to grave. You're born by us and you die by us most times. I know you never realize that, but it's true. We have that opportunity. You're born by us and you die by us. But what that does, it allows us the intervention and the ability to get data on people from day one, and families. So what is very important, and I'm listening here, really is even though we do have intersectoral collaboration among a number of the agencies, I think that we need to work a bit closer. Not only with the government and non-government agencies, but the society. Very close to identify the families at risk and how to use the resources. And I can tell you there are a tremendous amount of resources around. It's just that they're acting in different directions. We are sure about that. A lot of other resources are around. There's a question, and this is not a health question. There's a question that the society needs to answer. The question is the priority of children. That's the question. I wouldn't take it any further, but we have come from a place, and now we have street children as very much part of the framework, and everybody is quite comfortable with that. So I'm just saying, it's not just the health system, but also on the national security system or the social system, but the society has to place a value, because the systems that we have, we really reflect the values that is established in the social order. The Ministry of Health is ready to play its part, also in the prevention part, because that's the key to the thing. And whenever you talk about children and things happening about children, you have to talk about adults and what they are doing to the children. Child sexual abuse is a serious business, very, very serious business. From where we come, and national security, we know that, because we work closely with them. And there's no playing around with that when it comes to the health system with the national security. When you do these things, you pay the penalty. We have no problems with the council and all of that, but we see the end result of these things, the acute and the long term. But I said, what I'm interested in, and we would use the health system, and we are offering in the policy formulation and the resources in whatever is needed to bring this to the fore and provide our services in terms of pediatrics. And I heard Dr. Ramchan, which is saying that we need to look at some of our facilities. It's important, it's interesting sometimes where you get information, but we are on an infrastructure drive over the next couple of years. So what it says to me that when we are putting down our emergency services and our pediatric services, we need to look at the infrastructure in examinations to make the necessary arrangements for these kinds of things in the emergency arrangements. Because in the emergency arrangements, we tend to be looking at life-saving things and what, and we put in these things and not necessarily put other facilities to do other kinds of investigation and examinations that are more sensitive in a different nature. And I heard you, so that's something that we would need to do. The equipment, I don't think is that expensive or anything like that, and we should be able to do it. So my final comment would be on, I'm seeing something about the intervention model. I said I was not here for the presentations, so I would like to probably find out, maybe they can, those who have the intervention model can make some up, and we can have a discussion in the ministry about this intervention model to see what it is you're speaking of, whether it is in fact greater collaboration between all. How do we put it as a priority? How do we focus it? I have no doubt that the resources are there. I am confident of that. Resources about prioritization. Once you decide something is a priority, then you redirect the resources to it. If our children are not a priority, I don't know what else can be said. You know, I mean, I don't want to even go into that. So I give the commitment that the ministry will continue, improve. As I said, we have seen vast improvements. We are not only concerned about the sexual abuse, we are also concerned about the abuse, full stop. Because as I say, we see it in the health system, physical, mental, all of that, we see it. With respect to the HIV risk, we have the resources to make the intervention. We have the specialists, and we can in fact put together the training across the system, especially in the emergency departments, so that those who are there and in the pediatrics department, to make sure that we do the training and retraining to get us to where we need to be to protect our children. And with that, I would like to close my contribution. Thank you very much.
I just want to take the privilege of the chair from the seat of the task force, just to let you know that there are some other policy things that are going to be done from the level of the Children Protection Task Force. In a few weeks, we're going to be presenting to the key ministers of government a presentation on what are the critical actions that must be taken to address child sexual abuse based on the communities we went out to. So we're going to be making a presentation to the Minister of Health, Education, all the key ministers. And I mean, the presentation is complete, but there is some way that we may be able to get some of the information coming out of this research in that forum. So I'm happy to mention that. Also to say that we will be having dialogue with the managers of shelters, because I've heard from the findings that, you know, in all the agencies there's this issue of a difference of the definition of the child, and that has to be addressed. And we will be dialoguing soon, that is the task force, with the managers of shelters, with respect to expanding the shelters, but also in terms of their policies, which do hinder the provision of service delivery to victims of child sexual abuse. We will be also doing a social marketing campaign to educate, to sensitize, which would involve community caravans, school caravans, and we are also exploring a child protection mascot that's going to really be the mechanism for taking the message in to the community, to the national level, in terms of tips on child protection, how the child can protect his or herself, how parents could do it, and so on. So that you look out for that social marketing campaign. Also the integrated service delivery model that is being explored at the level of our ministry, sensitization and public on child sexual abuse in the public sector. We're going to be doing a train the trainers, so that each ministry will be able to train, not train, but sensitize their staff on the issue of child abuse and domestic violence. We're also looking at the probability of facilities for perpetrators, but we're just doing the research and seeing what jurisdictions do in this area, because we're not sure if we're culturally ready for this. It might take some time, but we are doing the research. We are exploring it. Looking at programs for the perpetrators. We know that family court, there is a program. We are looking at how we could take that program and expand it so that we treat with the perpetrators, and we try to do some rehabilitation there. In the ministry, we are also looking at setting up a child abuse registry so that we can have data on prevalence, okay? So we're moving towards that, and we also reconstituting our National Plan of Action for Children Committee, which is a coordinating mechanism in the government for looking at policy with respect to children, the Convention on the Rights of the Child, and implementing our National Plan of Action actually for children. Actually, we are at the point where we're going to do a new plan. Yeah, so just letting you know some of the other policy type activities that are taking place. So the floor is now open for questions. Yes, I see.
Afternoon, everyone. Nicole Hendrickson, Toko Foundation. Ms. Ramjati, I understand your recommendation for mandatory testing, and I'm going to switch it back to Mr. Comerbach. There are adults who are saying that the procedures for testing for HIV are not done the way they're supposed to be done. So if adults are saying that, I'm very concerned about the children.
Let me answer that one.
Hold on.
I want to answer that one time. These adults are accredited labs.
Sorry?
If you tell me that the procedure for testing is not done correctly,
Yes.
is only an expert can tell me that, you know.
What I'm saying is that there are certain procedures, not necessarily testing for the blood, but the procedure before even the blood is being drawn.
And I'm just saying to you, if you tell me that the procedures for testing are not done correctly, you have to be an expert. Because they had different procedures for testing.
Understood.
You have voluntary, and then you have provider-driven.
Understood.
Which one are we talking on?
Provider-driven.
And what that means? Just offering you a test.
Right.
That's what it means.
All right.
Okay, so
Understood.
Okay, let me just explain that one time, if I may. There's something called provider-driven HIV testing. What that says is that anybody interacting with the health system, the provider can offer you an HIV test, not necessarily with any major set of pre-test counseling. Okay?
Okay.
I'm just saying that. And that is a legitimate international approach, what they call provider-initiated. What it is attempting to do is get somebody to know what your status is. You may go for whatever. And then you have those that we thought voluntary when you're coming for the testing, where they comes in. So I just wanted to make sure.
Understood.
All right.
For 13 years, I've been hearing the HFLE being spoken about. We've talked about it. The Ministry of Education, international agencies have been speaking about it. But there's one organization that I know that found a very interesting way of getting young people involved, and they used a quiz process. And that was very successful to a point. But our own experience is that some of the schools are refusing to do it. There's one example that I know that they, in our area, where per term they choose a topic area. And for me, I don't think that is going to work, because then if you miss, because how the syllabus is. When you go through the syllabus, especially the curriculum model is a very, very good model. It's a very age-appropriate model that is very, very specific. And it's unfortunate that the schools, I'm not sure exactly which model they're using, but that's a very, very good model. So when you go through the whole syllabus, you're supposed to be a better citizen. That is what happens when you finish with that syllabus. It's a very, very comprehensive syllabus. And it's unfortunate that some of the teachers are telling us that they don't want to do it. So am I suggesting that there are organizations that are doing sexuality on a whole, with HIV being a very small component, partner with those agencies? Because our young people, one, are asking for the information, and I also, too, what I recognize is that the parents are also, because when the organization did that quiz, when we did the age appropriacy part, the parents were saying that they didn't think that their young people should have been exposed to that type of information. So I'm thinking if we partner with parents, with them first maybe getting comfortable with the syllabus, then I think we have a better idea of getting everybody else then involved in that process. And the last one is, where do the NGOs fit into all of this?
Thank you. Next.
Yeah, I wanted to follow up on a related theme, I guess. And that's a question about what kind of vision we have, what kind of policy vision we have broadly around sexuality for the country, for the nation. A lot of the conversation and the themes here have dwelled on these notions of victimhood and protection, and not necessarily the notion of sexual autonomy and of everybody in the nation, especially young people, but also adults, being able to control and enjoy their own sexuality. And one of my big challenges in the work that I do is getting that piece put into national policy making. And it clearly relates to these questions, in addition to the questions of protection. How are we creating a legal and a policy and a cultural framework that says that sexuality is something good and precious that needs to be protected and safeguarded, but also is about pleasure and something important, and about control of one's own self and one's enjoyment? And how in our policy making pieces and planning and wherever can we put that piece in as well?
I am Anthony Oliver, delighted to be in this conference. And I was, UNICEF says, Unite for Children. And I'm just delighted by the quality of the conference and the information that is being shared here. I am coming from, one of the things we realize is that we need to bring about transformation. That particular theme has been echoed over and over. And we really want to do that. And the whole issue of religion is critical to our country. Many people come from a faith-based orientation, pluralistic, but still a faith-based. And we are trying to, later in a couple months, we're going to be putting on a conference, something that we did in Jamaica, working with Compassion International. And I'm wondering, we did it in 2009, November 2009, and we're scheduled to do it at the Crown Plaza here in Trinidad in June. And we're wondering, with some of this information that's here, whether we can get some of the people from the various ministries having something similar, one, to do a panel discussion. Where, you know, what are these? We are targeting about 300 religious leaders, opinion leaders from the religious community, because sometimes part of the problem, I think, is that we're not able to, we need to bring about change, and we need to work with some of the opinion leaders in religion. Because sometimes religion can seem to be an obstacle, you know, in some of these things, as I say, in some of these taboo areas. But the time has come when many religious people are interested in being a partner. But sometimes they don't have the information, they don't know how acute the problem is, and they don't know how they can respond. So I'm wondering if there is the possibility that the various ministries represented here and some of the entities will be willing to partner with us. Certainly we will want to partner with them, one. And two, what sort of financial resources that might be available for the whole issue of education? It's partly education. It's making people aware. Some of that will come through, I suppose, once you have personnel, if they're provided. I mean, that's a contribution in kind. But what is available in terms of from the various government entities to assist in helping religious leaders be more informed?
With respect to NGOs and CBOs and FBOs, we have, those are the members of the civil society. And we have our PIU division in our ministry, where they will be part of them and help them with groups and information, education. And we also have grants that they could access to help the community, individuals. So they could access it through our ministry. We have offices in nearly all of the counties, is most likely in a social welfare building. So you could go there and access the grants and the information that is needed to help with the groups and information with respect to all aspects of the civil society.
Yeah, the project implementation unit, yes, which really would treat with infrastructure. Some NGOs which wish assistance with respect to infrastructure, yes. And then we also have the Social Investigations Division, which would be responsible for assessing your requests for support and then making a recommendation, yes. So those are the two divisions in the ministry, yeah. Also to say that currently we give subventions to about 70 NGOs in various categories, and that we are always willing to support and collaborate with the NGOs in their programming, in the work that they do, because generally the policy at the ministry level is that we would collaborate rather than actually have government set up these facilities, yes?
What I could say with HFLE, that up to a year ago, Trinidad and Tobago was not using the curriculum model. The curriculum model was piloted in 9 countries. Trinidad and Tobago was not one of them. Trinidad and Tobago, however, does have a curriculum, whether it is in use. Up to a year ago, I know that it was used in less than 7 primary schools. There's also a rapid assessment of the HIV and AIDS response of the Ministry of Education that I'm sure can be available, I'm sure, at the Student Support Service. You can make reference to that, and that is going to give you some direction as to where Trinidad is with respect to and in the Ministry of Trinidad and the Ministry of Education with respect to its HIV and AIDS responses. So, and with respect to the role of where does the NGO fit in, there's an HIV and AIDS policy of the Ministry of Education. And in the back of the policy, there's a part marked standards, and the standards give some indication as to how NGOs can respond with respect to ministry. And that policy, as far as I know to date, is still in existence and has not been adjusted or reviewed. So I think you can make reference to that.
Policy vision, but the vision for health in terms of children is to ensure as I said, from the womb, that the best information, services, prevention, etc., is provided to mother and child, etc. Not only, and we are looking to work with anyone, because health services they are delivered within institutions, but the whole question of health really starts in the community and the home, in terms of what are the things that you need to do to become and remain healthy. So we're looking to work with anyone in relation to that, including sexual health. But so our vision in terms of health is broad-based and very general with respect to the population. So I can speak to the vision of health, but not with respect to sexual health. That's a different matter. Well, it's encompassed, but there's not a specific focus of the ministry. We have issues there, but as I said, it's not a specific focus.
And at this stage, what I can say is that you know that there was a draft that was laid in Parliament as a green paper in 2009. And with the elections last year, we all know that we had to redirect a lot of things. The ministry, when we submitted then, we wanted the Ministry of Community Development and Culture and Gender Affairs, but the issues remained the same. We didn't, when it was laid, it was out there for public comments. We received comments from several organizations, including CAISO, the UN systems, a lot of the religious bodies, a lot of comments. Those were summarized and submitted to our current minister, Minister King, and they are, in fact, reviewing those comments. And I would imagine, because just this week, I got an email from one of the heads of the ministry saying that they plan to revisit the project very shortly, because actually the minister had asked, for follow-up action, and I think she had contacted the Center for Gender and Development Studies to have a follow-up meeting. I don't know what transpired, but I know there is something in the making. I hope it doesn't take too long, where a decision would be made in terms of how they plan to go forward. I know the whole issue of sexual autonomy is a very burning issue. And it's interesting that, just recently I was at a forum and where we were looking at national plans. We were just, because we are now in the planning ministry, and here we were sitting with people who are required to do some of the national planning. And somebody said, when you speak about agency, what do you speak about? So even in terms of the language that is used in the field of gender, it's new to a lot of people. So if you talk about sexual autonomy, people say, where is that? And so it's a whole new learning process. And so I am very optimistic that something is going to happen. I don't know which way it would go, but let's hope that, at least Trinidad and Tobago could hear, about some kind of action going forward in terms of what is going to be accepted, what is not going to be accepted, if everything is going to be back. I know the Prime Minister did indicate when asked in preparation for election that some things were going to be up for, help me, not consultation, no, there's a new, was it referendum? I can't remember, let me not misquote her. But in other words, there was going to be some dialogue and consultation in some matters, and so I know even that is going to be an issue of a debate, whether she should continue to go out again, what should we go forward with. So, but I know as a fact that there is some background action taking place on it right now.
I'd like to respond to the request of Dr. Oliver. The Children's Authority would be more than willing to participate in your thing. The Children's Authority have been, and we are prepared to respond to any request where we have been trying to explain to people the requirements in the legislation. And like I said, they're only of the children's package. The ones we are talking about is primarily the Children's Authority Act, so that people understand what the Children's Authority is all about, and also the Community Residences Foster Care and Nursery Act, because the Children's Authority is in fact the authority with responsibility for foster care, all homes in Trinidad, homes for children in Trinidad and Tobago. And a number of people have been, talking about homes and shortages, etc. There are actually 59 children homes in Trinidad and Tobago. Well, 1 in Tobago, 58 in Trinidad, 4 state managed in conjunction with religious bodies, and the others are private. So there are quite a number of homes. I think we have about 11 homes for, and Monica, you can correct me on this one. The list I'm working with is that we have 11 homes, or you have the same 11, for shelters for women. And yes, the reality is that different homes cater for different ages. And yes, it is a reality that some homes, some shelters will say, okay, we will take the mother and maybe a female child of a certain age, but not the male child. And the list we have, we know what homes take which gender and what ages. So we have that information up front. But specifically speaking with regards to the legislation, the children's bill at this point in time is still at a certain stage where it cannot be made public, and we will not engage in a public discussion on it. However, by the time your conference, it might be in the Parliament, and if it's late in the Parliament, then we can talk to it, because there are some very interesting provisions in the children's bill which the public has to come to terms with. For example, one of the provisions, and I'm not getting into all the technicalities of the bill, but one of the provisions will deal with the issue of corporal punishment. And there are some people who believe, wrongfully so, that corporal punishment has already been removed and so on. But it's going to talk to the issue of teachers and corporal punishment. There's a whole new wide range of sexual offenses. So in terms of the findings of, and the research conducted, we will have to go back and now do some new studies, further studies, because I would imagine the data collected in this study would not have taken into consideration the other ranges of sexual offenses that are now there. And it's also going to talk about the increase in compulsory school age and all that. So there are some very interesting things in the children's bill. And maybe by your conference, that might be, the bill might be in Parliament by then. I'm saying might, and if it gets there, then we'll also be able to discuss that. But we'll be more than willing to discuss the Children's Authority Act, and the Community Residences, Foster Care, and Nursery Act, and let you know what is expected of everybody in that context. And it is true to say that many of the private homes which are run in Trinidad for children, many of them are sponsored by religious groups. The Christian community, in various groups within the Christian community, Hindus, the Swaha group in particular, and the Muslim faith. So all three major groupings, Hindus, Muslim, and Christianity in its various permutations, do run the majority of private homes in the country.
I know we have representatives from different ministries, and in policy, what would be put in place that a child, whether they go to the police station, and I know we have victim support officers, but it's a vicious cycle, and we understand that child sexual abuse manifests itself in different ways, and in different forums, people are exposed to different things. So a child may come to the station and they've been abused, and the child is in school personnel may not know, student support may not know what is happening, or if it's in health or anything like that, or an NGO, what would be put in place to ensure that a child is taken care of? Because beside at home, the child is in school, the child may display things and people may not know what is happening. They may be treated differently and without really knowing the cause and treating with the child's sexual abuse.
I'm a bit concerned, I'm very confused by the level of not really misunderstanding, but like the doctor from Mount Hope, and that's one in case of, the services there. I'm very shocked, but I'm glad for honesty. And I am very glad that Dr. Kumabach, came to our assistance. I do hope, though, that in reality check, that the effect of it will be definitely be a positive one. But then we have other issues in terms of the police and the health services, Dr. Kumabach, where when children are assessed, there seem to be conflicting relationship or outcome of the doctors in some of the institutions who indicate that the child penetration is not forthcoming. And you have the national security on the other hand, where police are not willing to investigate other types of abuse, sexual abuse. Like if they say the child is not raped because it's penetration, the child has been molested because the law indicates that the child wants exposure of the genitals. The child has been abused, and that is under sexual abuse. But in some cases, the police is not willing to investigate those areas because the investigation seems long. Also, if you don't continue to pursue areas of alleged sexual abuse, in some areas where the police is concerned, the cases are dropped. And therefore the child feels that they are not being given their right because they are being violated by the perpetrator, and yet still those in authority are not willing to continue to pursue whether it's foreign or whatnot. So I think that there needs to be rationalization between the police and the health and national security. Those things are affecting parents and children over and over and over and over again. And we keep saying child sexual abuse, come, report it, and nothing is being done. Or the matter is shelved and shelved, who's foreign and whatnot. Can I get some response?
First of all, we had in place a national plan of action. Then we had a Children's Authority Board placed, and recently we had a Child Protection Task Force. I just want to get some feedback on the streamlining of all these authorities that we have. If we're towards the best interest of our children, we have so many things in place. What is the streamlining that's going to be put in place? Second of all, in terms of consultation, while we have worked towards the Children's Authority being put in place, I know there was consultation in communities and with agencies. I just want to know if that consultation was, in the case of agencies, with staff members. We have a habit of saying we consulted agencies, but we only speak with the directors. So I want to know if consultation was with practitioners who actually do the work on the field, and consultation in the communities, that it was not just a quota, we need to get 5 communities, so we just go to 5 communities, but we really want to get the information. And the last one, I don't know if anyone will be able to answer, but just an important comment. If we are saying, we have many persons from student support services here, and they will all admit that they're stretched to the limits. If it is we want, and HFLE has its concerns, as we said, in terms of implementation, if we want to educate our children about child sexual abuse and things like these, we have NGOs and groups willing to go into schools, and we are now debarring these groups from going into the school based on a new Ministry of Education policy with extracurricular and with groups going into school. How do we aim to do it if we do not have enough personnel in the student support services? They're stretched to the limits, and we're not allowing these groups into the school. Thank you.
I wanted to ask Dr. Cumberbatch, considering that health is so all-embracing, as you said, from birth to death, and considering also that the public health model is the one that we're expected to use because it's so highly recommended, I wanted to ask if you would consider a health passport. And this is just taking the immunization card that already exists and adding 3 more lines to it that would be checked regularly when the immunizations are checked. And these would be for developmental issues such as cognitive, emotional, and psychological health. So it's really very simple to add these hugely helpful developmental areas to checking within the already existing health schedule. It provides an early alert that something is wrong. And the existing schedule within health and also is linked to education. As children go to school, the immunization card has to be checked. And as they go through the levels of education as well. And I think it could be integrated in other areas. And also I found that it takes very little time, it's very inexpensive to use, and it's also making a huge impact in transforming the lives of children in the other islands where it has been used. Thank you.
Thank you so much, and I will suggest that health starts the answer because that's where we ended in terms of the passport and also the issue of the assessment at health services and the conflict or seeming conflict with what is actually assessed at the health institution and the police. I saw the link with the police, so I don't know if you could probably in 2 minutes or less speak to those issues, Dr. Cumberbatch.
Thank you very much. We are actively looking at that issue of the health passport and what we put on it to extend that immunization card, which is something like a health passport. In fact, we use it in some areas in chronic diseases. But not only that, what is on the table is the question of continuing that, as we call it, as you call it, the passport, but at different ages that would speak to what's there at the birth, what is there on the entry to primary school, what is there in entry to secondary school. So continuing information. So what you're speaking of, we have already embraced the idea and we'll be moving forward. Of course, we'll have, before we move to that kind of implementation, we'll have discussions with all, because the issue here in the modern world, the question of something on a piece of paper, as opposed to the technology, is really how we have to go forward. So we have embraced the idea, and it even goes further than that. Just to give people an idea of what is on the cards in the world is really people having their own electronic medical records available to them at all times. That is where the world is going. So you'll have available to you your electronic medical record from cradle to grave, and you just bring it up on your database and it's all there, and you can share it with whoever you want to. And that is where the world is going. So yes, we are on that. With respect to what the gentleman raised, we operated within the law, but I understand what you're saying in that we need to work closely and comprehensively to make sure that all aspects of the abuse process is followed up. And we hear you, and we will take that on board. I understand exactly what you're saying. Because the way the law is now, when you bring the person to be medically assessed, the history is one thing, and the examination. So you find that unless you have clear clinical evidence of something, then you're going by the history. And that is where, even in taking the history from a child, you have to be highly trained to do that. And I heard it said before, the question of going back and re-interviewing is something we need to look at, how you do that. But also then the legal process becomes an issue. But I hear you, and I think that is an important idea that we'll have to work to make sure that we follow up and we don't just turn our backs at the first sign that maybe the story needs to be checked further and further and further. But we will do that as we move along. But it's the sensitization of our health professionals, that this is an issue that you need to pay attention to. One must remember that and I'm not making excuses to the health professionals, but the health professionals in the emergency departments, they're faced with a myriad of things, and more, the request being made for them to respond to that. So in order to respond to things like sexual abuse in children, as Dr. Ramchandran was saying, we have to do a lot more training and make sure the facilities are there so that when the patients do come in, they go to those who are trained for it, as opposed to a professional who really does not have the specialized training and the equipment. Otherwise, they would not necessarily gather the right information. But we hear you, but as I said, we're expanding the role and the responsibilities.
Said previously, I am not addressing this issue from a policing point of view, but I'm looking at it at the center of the whole equation is the police and how the police respond and what kind of support that the police needs in responding. Now, child sexual abuse, I think we can all come to the conclusion that it's not a single variable issue. It's multivariate, so therefore the responses has to be a multivariate response. And if the police is to be effective, then it calls for a response from the other support networks, including, as Dr. Kamabat said, the accident and emergency. You know, and I spoke yesterday about the fact that how reports come, having worked myself in a child guidance clinic and having been exposed to these medical certificates that are sometimes sent for children who have been sexually abused, and they just have hymen intact with no description of the hymen or no description of positioning of the hymen, and that is what the police has to work with. You know, so that is one aspect of it, but there is need for training at that level. And I also made mention of the fact of police support from the victim support level. The victim support can be effective in supporting the police with helping to get families to the place where they are ready to disclose and they can disclose, because as Dr. Kamajbat said, in the absence of clinical evidence, you need a history. And if there is no physical evidence, if there is no penetrative sex, then you have to go by the history. And oftentimes, children can decant. Children can change their mind because of pressures from the family and so on. And that is where the police can be supported by their victim support service. Additionally, sometimes police themselves are human beings and are affected, and also they need support, emotional support for themselves and their families, as well as education. The social service unit, the employee assistance unit of the police service is responsive in that respect, and the response is, can be looked at broadly in three categories. There's the education response, and the unit is actively involved in providing education. In 2 weeks' time, there will be a symposium for police officers on HIV and AIDS and alcoholism, and there will be other symposiums and other such situations occurring in different divisions. So the response and the support can be given at that level in terms of education. And additionally, police can be supported and their families can be supported emotionally to do this kind of work with direct intervention through emotional support, through debriefing and so on. And additionally, there's also a resource person component of the service where officers can call upon the unit to provide resource assistance. So in terms of what the what the police service is doing, that is what it is doing in helping to ensure that the response given and the work given is more effective.
Thank you. And finally, Children's Authority, Mr. Raghunanan, there were two issues here in terms of the consultations and who participated and in terms of the streamlining of the agencies?
Okay, in terms of consultations, the Children's Authority would have, well, the implementation committee prior to the board being appointed ran a couple public consultations. With respect to the homes, there is upcoming consultations where all staff and managers will be consulted, and we will also be visiting homes. A consultant has been selected with the assistance of UNICEF to write standards and to develop the licensing system, because the Act calls for every home to be, you cannot operate a home until you are, except you are licensed. So a licensing system has to be put in place. To get the licensing system going, you have to develop standards. So a consultant has been selected, and we are waiting really on the recruitment of staff, because what we have right now is just the board. And the consultants should really be working with the staff, to carry out that aspect of the work. And as I said, interviews are going to be starting tomorrow, because we just recently, we had a compensation package approved by the CPO and so on. And that was, and now that we have that, we can recruit staff. As soon as that is in place, we hope to complete that in the next couple of weeks. The consultant has been selected through UNICEF. The consultant will be so informed as to the timing. But it's we recognize it as a matter of urgency to get that consultancy going. Once the consultant is on board, consultations will take place with the children's homes. Like I said, we have all the data in. We know the homes, we know where they exist, we know what kind of numbers they have, etc. We have that kind of data. And there will be the consultations at that level. And once the standards are set, the licenses system is in place, training for staff in all the homes, because people will be required to come up to the standards. And it's not the view of the board, the present board, to shut anybody down, but hopefully we can help all homes come up to the minimum required standards, because we do recognize that these homes have been doing a tremendous amount of good over the years, and we want to support them and bring them up to standard. And then through the state, we would see what institutions we need to establish to complement what already exists. So I don't know if that answered your question. With respect to the multiple things happening, the Children's Authority is the central agency. There's absolutely no doubt about that. However, there has been a common agreement between the board and the Ministry of People and Social Development, that Ministry of People and Social Development will continue to provide the services that are being provided until the board becomes operational. When the board becomes operational, a number of the services which are now provided will fall under the remit of the board. The National Plan of Action for Children, that's a different thing. And where that will fall is I guess that's a different issue. But the National Plan of Action for Children, the main remit of that organization, and probably DPS the chair should really speak on that issue, since she would have response. But that's really to monitor and evaluate the implementation of the CRC in the country. So that has a different responsibility. But like I said,
yes, thank you so much. And just to close, to say that the discussion is to continue with the Children's Authority Board in terms of the roles with respect to the National Plan of Action for Children, and how the ministry and the authority will determine which way it goes. Yeah? So that dialogue is still open. So participants, could I invite you to show appreciation to our panelists this afternoon as we close this very interesting session on implications for policy, and as I indicate too that the dialogue could only continue from here on. Thank you so much.
Gonna make it through this darkness. A light will shine someday for me. Yes, it will. I know that you won't leave me in this thing. Something doesn't feel right. Could somebody help me? I heard him say, hush, don't say a word. Gonna get messy if anybody heard. I heard him say, hush, don't say a thing. Think about the trouble you put me in. I heard him say, hush, don't you know who I am? A well-known woman, a respected man. Something doesn't feel right. Could somebody help me? Something doesn't feel right. Could somebody help me? I heard him say, hush, don't say a word. Gonna get messy if anybody heard. I heard him say, hush, don't say a thing. Think about the trouble you'll put me in. I heard him say, hush, don't you know who I am? A well-known woman, a respected man. I'm breaking the silence 'cause I'm under attack. No, I'm breaking the silence and take my life back. No, I'm breaking the silence and take my life back.